health analytics organisation. We're based in London, and we work very closely with the NHS. And we use a large amount of structured health and care data. We link that so that sort of it reflects all of someone's care rather than just the care received in one setting. And we use that information to try and understand really whether the care that someone's receiving is making a difference to their life or not. And so we call that outcomes. We're measuring health outcomes, and there's a whole variety of sort of technical underpinnings to that. In terms of timing, it was quite fortuitous that we had actually been doing a lot of work with NHS England and Public Health England in the run-up to the pandemic to create and develop a data set which enabled us to understand at the onset of the pandemic whether really the proportion of the population that were vulnerable to serious illness from COVID-19. For example, we now know that if you have certain long-term conditions or undergoing certain treatments, that can put you at much greater risk of developing serious illness from COVID-19. That information hasn't routinely been widely available or widely available to NHS England and Public Health England in a timely manner to be able to sort of respond to the pandemic before. But through the work we've been doing locally and nationally over the last few years, we've developed this data set and data model and data approach, which was then able to be rapidly sort of redeployed as part of the pandemic response. So I suppose apart from the sort of impact on the team and sort of changes to remote working and really getting used to all of that sort of human stuff that's changed and is all around us, I think in terms of the services that we offer and the products that we offer, it really has given a real opportunity to sort of shine the light on the potential of some of these analytics approaches and products that we produce. In particular, some of the data sets have been used to publish. The NHS England has used one of the data sets I've mentioned that we produce, that we co-produce with our colleagues in NHS England and another organisation called Arden and Gem Commissioning Support Unit. And that data set has been used to research things like the additional risk of serious illness for people living with diabetes. And that was published as a landmark publication in The Lancet last summer, and still remains the sort of authoritative view of the additional risk that people do or don't otherwise have from living with B. Also been used to help try and identify and prioritise some of the areas for vaccination in terms of the identifying vulnerable populations and helping plan logistics around vaccination and distribution for people in those vulnerable cohorts that have been prioritised for vaccination. So it's been used for a variety of different things, really, I suppose, over the course of the pandemic, and it's been, I suppose, time-wise, it's been everything has been needed urgently, so that has been quite challenging, and particularly working remotely has been challenging. But through greater collaboration, through really just a can-do attitude, it's really enabled massive progress, I think, over the period of the pandemic. So I originally started out life as a hospital doctor and then a GP, and I was a GP in the Scottish Borders for nearly 5 years, and which is a lovely part of the world. I trained in hospital medicine in London, but I was always interested in payment systems, partly because my father was an accountant. And I used to go on audit with him when I was a teenager in the summer holidays, and that taught me that I didn't necessarily want to be an accountant, but I did want to find out how money moves around the NHS. And I found as a GP, I experienced firsthand how payment systems, in particular in healthcare, don't necessarily align with what matters most to people and their families, and oftentimes don't even align with best clinical practice. Sometimes there are actually financial disincentives to do the right thing in healthcare, and that's not just the UK, that's worldwide. And also, we often pay for care that we don't know if it's actually making any difference. We will pay for operations and treatments and procedures when actually the money may be better spent on prevention activities to stop people even becoming patients in the first place. So this plays it where this sort of the slightly dysfunctional payment system plays its way out in healthcare in myriad ways. And I experienced some of that as a GP. And I actually just thought if I wasn't part of the solution, then I was part of the problem. And so I worked at the Department of Health for a couple of years, and then in an accountancy firm, but not as an accountant. I actually found myself working for the first time where my boss was not a medic, and he was actually an accountant. So I retrained in finance at that point, and set up OBH, which is Outcomes-Based Healthcare, our company, with a view to trying to understand how we measure whether healthcare is making a difference or not, so that we can then reward and incentivize healthcare providers, GPs, hospitals, and so on, who actually do provide better outcomes. And that was really the sort of inspiration behind things. That has now grown, so that the original mission has now grown from, rather than just incentivizing treatment for people who are already ill, already experiencing significant illness, towards prevention, and actually focusing on measuring through something called health span, which is a measure of population level healthy lifespan. We can measure how long people stay in good health as a proportion of their overall lifespan, and in doing so, that enables us to be able to measure whether the system is making a difference or not in terms of prevention, but also paying for prevention. So that's how our sort of mission has grown, I suppose, over time. Colleagues and co-founders told me we should enter this because we can fly the Queen's Award flag. On a slightly more serious note, I think one of the things that appealed and attracted was we've previously been involved in a innovation accelerator program run by NHS England, the NHS Innovation Accelerator, and we were selected for that a few years ago, and that was a really positive experience for us. And we were on that program for 3 years. This supported us in terms of adoption across the NHS, and gave us really access to a wide range of mentorship, support, and a degree of recognition as well, which is important for the team, and recognizing the hard work that they're doing. And I think we saw some parallels in the Queen's Awards to that, in terms of team morale, recognition, also growth, sales growth, but not just growth for growth's sake. It's sort of growth with an ethical underpinning, and really a lot of those sort of values come through the Queen's Award. And I think we're particularly attracted to the fact that there's an innovation category, and that's something that we really do see ourselves as being sort of at the forefront of innovation in the space that we operate in, which is healthcare analytics. So I suppose a combination of things, really, but really reflecting our brand and what we want to stand for.